Hello, everyone. My name is Craig Andrade, Associate Dean for Practice and Director of the Activist Lab at Boston University School of Public Health. Thank you for joining us for this public health conversation starter. Today, I have the privilege of speaking with Paul Shoemaker, who is the Director of the Environmental and Occupational Division of the Boston Public Health Commission. Mr. Shoemaker has been working with the Boston Public Health Commission for 27 years. In his position, he directs 5 programs which are rooted in environmental justice and advancing health equity and providing environmental and occupational health for services, occupational health services to the residents of Boston. Mr. Shoemaker has his MPH from George Washington University School of Medicine and Health Sciences, and MBA from the Questrom School of Business at Boston University. Thank you for being with us today, Paul.
Oh, hello, and thank you for having me. It's good talking with you today.
So let's start our conversation by asking you to tell us a little bit about what brought you to the work that you're doing.
Sure. Well, as I like to tell folks, I came to public health from a path that a lot of people, it seems, took. Um, in undergrad, I was the complete stereotype, the biology major who wanted to be a doctor, and I got as far as wait lists at medical school, and decided, well, I need to boost my credentials a little bit for that second run. Why don't I take this public health degree and see where that takes me? And about one semester into the public health degree, I realized that public health was actually the thing about medicine that really spoke to me, was that component of influencing the environment and the structures in which people live, work, and play,
Mm.
that influences their health, and making the whole healthy to prevent health hazards. So that brought me to applying to my first job at the Boston Public Health Commission, which saw me in the environmental health office working with one of our programs I'll talk about in a moment, working on permitting of asbestos projects in the city. And I've just sort of grown from there because environmental health is such a varied field. And, the thing that keeps me there is the reward of being able to see direct impact and the variety of all the stuff we have in environmental health.
Mm. Mm. Can you say a little bit more about the Division of Environmental Health and Occupational Health and on the 5 programs that you run?
Absolutely. So I'm going to get a little in the weeds, so pardon the context. But if you look at the organizational structure of the commission, it looks a bit like a spider web. The Boston Public Health Commission has, I think at this point, over 1,100 employees across 6 bureaus and multiple service centers. And that includes everything from the EMTs with Boston EMS and Boston Homeless, through to the bureau that I'm in, which is the Community Initiatives Bureau, which is a group of programs that do a lot of direct community support and direct programming. And my little piece of that is the Environmental and Occupational Health Division. When we're at full staff, which hint for anybody watching and listening and who's looking, we currently have a couple of positions open. But when we're at full staff, there's 25 of us responsible for the broad mission of protecting the health of the residents of Boston from all harms in the environment.
Mm.
Functionally, what that means is that under my division, we have the Boston Childhood Lead Poisoning Prevention Program, which responds to cases where a child is exposed to lead, with in-home health education, case management, and environmental inspection and enforcement to remove those lead hazards and to help that family. We have an environmental hazards program more generally, which responds to complaints from residents of the city and visitors to the city for the broad range of environmental hazards. So that's everything from there's been a leak in my apartment for the past month and the landlord hasn't fixed it. And now the mold is growing everywhere and my asthma is being triggered, through to things like oil spills and noise complaints and sort of you name it, we've probably involved in some way or another. I've been on a few more hoarding inspections than I care to count at this point. um, so that's 2 out of the 5. The third and one of our large pieces is environmental permitting and regulation. We regulate 9 different industries in the city, um, from burial permits, where I serve as the burial agent for the city of Boston, as part of the vital records process, through to asbestos removal projects and certain solid permitting of certain solid waste businesses in the city, all the way through to things like tanning salons, nail salons, and body art establishments. And in all of those, our role is protecting the clients and the workers and the neighbors of those businesses from environmental hazards. So that keeps us quite busy. Related to those businesses, we have our Safe Shops program, which is an education, outreach, and technical assistance program that works with small businesses around supporting those owners and workers in worker protection from hazards on the job and reducing their pollution emissions through best practices and alternative products to reduce their burden on the environment. And then sort of lastly, we have a piece that sort of caps the whole thing, which is our education and outreach program, which supports all of those through community health education and community outreach. And sort of under that or to the side of that, I also wear the hat of doing a lot of climate change work for the Public Health Commission. So, like I said, environmental health is everywhere.
Yeah. Wow. And that's quite a portfolio to manage and given the city and its long history, I wonder when it comes to the lead mediation, the law, the old stock that we have of residents across Boston, does that how are we doing with that? Are we still having a lot of instances of young children getting lead poisoning and things?
So that's a tale of both public health success and still work to do.
Mm,
So you're very right. I believe it's about 75% of the housing units in Boston, as of last check, were built pre-1978, which means that they're likely to have lead paint in them, which is the primary source of lead exposure for children in Boston. Um, Running parallel to that, we have a fairly high screening rate. It's about 75% as well, although it took a dip during COVID and we're still getting it up there, and I'd rather see it at about 95% or higher. But that said, we're seeing most of the children in Boston screened for lead poisoning, and I'm happy to say that the graph of lead poisoning cases in Boston is one that I like to bring out when we talk about successes of public health, because we went from a point where back 2, 3, 4 decades ago, the definition of lead poisoning was a blood lead level of 25 micrograms per deciliter or higher. It's now been reduced to 10 as the threshold. And despite that, we've gone from a point where we were seeing thousands of children a year defined as lead poisoned, to the point where we're down to less than 1% of children screened every year are lead poisoned. So functionally, that means between 40 and 50 children a year are identified in Boston as lead poisoned. There's another couple of hundred or so who are identified as having blood lead levels of concern. And we want to reach them before they become poisoned, because if we remove those lead hazards from the home, whether it's deteriorating lead paint or it's products that have lead in them, um, you get rid of the lead, you get rid of the risk.
yeah, yeah. I at in another life, I was a nurse at Boston City Hospital and then Boston Medical Center in the 80s. I remember numbers of young people coming in with lead poisoning, and the challenging treatment of that is not for the fair at heart. I mean, it doesn't taste good. It's just a challenge, and the long-term effects of that damage could be devastating on learning and all of that kind of thing.
Oh, absolutely. I mean, there's looking into the literature, it's frightening the long-term effects that lead exposure can have on children.
Yeah.
And, again, it's just I've been around this long enough that I remember back in the day when a child would come in with a blood lead level of 30 and
Hmm.
okay, well, they're middle of the pack. And now we're seeing children with, blood lead level of 18 or 19, and the alarm bells are going off because that's a big deal and a very high number. And that's encouraging to me.
As you say, one of public health successes, and especially in Boston. That's great to hear.
Absolutely.
Is there a particular program in your division that you'd like to highlight?
Well, we've already talked a ton about lead, and I think that's that's an important one. But I do want to hold up the inspectors that are working every day on response to complaints from residents of Boston, because that team is out there every day solving problems in the environmental quality and daily life of folks in the city.
Hmm.
And it's very hard to sort of wrap a narrative around them the way we do with lead, because they do deal with so much variety of issues. So I always like to acknowledge and encourage them. But something with an easier bow around it is our safe shops work, which I'm very proud of the work that they're doing, because they're protecting workers in small businesses that are particularly vulnerable from environmental exposures. And that can be, say, for example, a nail technician who's working at a small nail salon, and maybe a recent or first generation immigrant to the country, isn't connected with a lot of resources, and information, and we're helping make that environment where they're earning a living to support themselves and their family healthier for them, to protect their health, protect the health of their clients, reduce pollution that's going into the environment. And a lot of times we can even tie the extra bow on that of helping save the business owner money, so that it's that triple win that we're always trying to get in public health. So I really like to talk about them too.
Well, and to give kudos to all the hard work that's happening and all across everything you just described. Yeah.
Absolutely.
Yeah.
I'm here talking and being the face, but it's the team that you don't see behind me that get it all done.
Yeah. Yeah. Um, the as we face this challenge that we're in right now, a new administration with some uncertainties in the protection of environmental justice and environmental health, have you altered your public health practice in any way? And if so, what do you think? And also, what do you think we as a collective can do to support the work in protecting our environment locally?
That's a big question. So I think the key to that is your last word, locally.
Mhm.
Um, I, I acknowledge that there's a lot of uncertainty on the federal level, and it's causing no small amount of stress in the public health fields. But when it comes to the day-to-day of our work, our focus is continuing to stay on the mission of the Public Health Commission to address and correct environmental injustices and health inequities, and to serve the residents of Boston. And we I'm in the fortunate position where our funding streams are local, our resources are local, and we can have that focus on making that day-to-day difference on the local level. And as public health, we've been in these positions before where action on the local level serves as an example. We're keeping the lights on and keeping the mission forefront in our minds. And really, the nice thing about that too is that working on the local level, we can directly see our impact, which goes a long way. Having gone through this myself, it goes a long way to morale of the folks in the workforce that keeps us coming back every day. So that's our primary piece. And then I think that, again, it's one of these struggles of, making sure that I don't want to borrow the pat phrase, the keep calm and carry on,
Mm.
but keeping that focus, keeping that action on the local level is, really the important thing at this point, because you know we might not be able to affect the large picture, but I can protect my folks here on the local level from, you know, even the small things make a huge difference. That leak in the apartment, those bed bugs.
Oh, I just had a flashback with bed bugs on a college campus where I was part of student life, and those are tough things to get rid of.
Oh yes. That it's one of the more frustrating. I mean, hoarding cases are probably one of our most frustrating individual small scale cases, but bed bugs are right up there because, they don't carry diseases, but they're such a detriment to quality of life and peace of mind, and they're so hard to get rid of. And they take a lot of work.
Right, that's right. We're here today in a day on in April where it's going to be 65 degrees, and we acknowledge that we've had some summers recently that have really gotten hot, and the environment and global warming is really showing itself in all kinds of ways. Can you say a little bit about how you and your team work to support protecting um, residents in ways that manage the heat, that manage the risk of flood, and all the other elements that we're watching in real time that happen in other states, particularly on the West Coast and elsewhere? How does that work with your team, and what do you do to mitigate the challenges to health with all of our residents?
Yeah, absolutely. So I'll state first of all that I and my team um, don't play a direct role in response to the incidents.
Mhm.
We're very fortunate to have a strong Boston Emergency Management Office and the Public Health Preparedness Office at the Commission, who do a lot of that direct work. And so we're coming into the summer season, so we're talking about things like standing up cooling centers. Um, we've the city's got great folks doing that. Where my team gets more involved, where I get more involved, is in the policy and the education areas. So my outreach teams are spreading information about the health impacts of climate change and resources to either um, improve resilience to climate change or to try to mitigate climate change. And there's a lot going on in the city. I was I'm fortunate to have a seat in some of those discussions at City Hall that are currently going on around the city's climate action plans and efforts to reduce our greenhouse gas emissions. And I'll I'll crow a little bit about my programs again by throwing back to a project that we started back in 2007 that I think sums up public health and climate change,
Mhm.
which is Boston Clean Air Cabs. If you're out on the street at any time in Boston, you see one of those taxi cabs go by that's got the green slash down the side of it that shows that it's a hybrid vehicle. That's a project that came out of a member of the public walking into the lobby of my building one day and just asking if there was somebody around that he could talk to about climate change and cabs. And I happened to be the person that came out to the lobby and met him. And from that, we got this ball rolling of, look at all these old Crown Victorias that are used as cabs. They're getting about 9 miles to the gallon. Can't we replace those with hybrid vehicles that are getting 30 to 40 miles to the gallon? Okay, this sounds like a great idea. He and I took that to the Hackney division at Boston Police. We took it to the cab associations, and the role that public health played there was that we had the language to speak to people in the issues that were of concern. So, you know, I've got my numbers to show you fuel consumption. So as a driver, I can show you how much money you're going to save. I've got my numbers for, this is the climate change impacts that you're going to see coming out of the tailpipes. And if you want to talk to me about climate change is just a hoax, okay, let's assume that. Let me talk to you from a public health standpoint about vehicle exhaust coming out of the tailpipe and children with asthma in the city of Boston. And again, that's a big role that public health plays, is that we're looking at those health impacts and the fact that regardless of anything else, those health impacts are coming, and here's how we want to address them. And so it's, it's heat waves, it's cooling resources, it's extreme weather in the winter, and things like, we have a major blizzard, and now power's out and people are running generators. Well, my team's there to remind everybody that carbon monoxide is a risk, and don't run those generators indoors. Same thing with, pumps and cleaning up after flooding events. And, so that's the major role that our office plays there. I could probably ramble for hours about that. So
Well, no, I really appreciate that element and bringing, the larger ecosystem that's trying to do the direct care when there's heat emergencies and all of that, and then the upstream approach of how do we make sure that we're doing policy and engaging our infrastructure in a way that helps us be resilient and protect our populations in all kinds of ways. I wonder, Paul, given your long history in this work, what would you tell public health students that are passionate about environmental health and occupational health? What would you tell them how they could continue to build their practice as they prepare to graduate and get into the world to do the work?
absolutely. So I, it's going to sound a little trite, but get involved is a very good mantra here. I know that through the BU programs, there's lots of opportunities for practical projects, and those can, I started off my public health career as an MPH student, and one of my practical projects was working with the faith community in Alexandria, Virginia, working through the wives of pastors and rabbis to encourage their congregations on childhood vaccination rates. And that kind of snowballed. So, taking advantage of those projects and those opportunities, and even going beyond, there's a ton of community organizations in and around Boston that are working on a variety of environmental health concerns, or even just public health concerns in general. But, I see the environment stuff mostly. So, there's, for whatever you're interested in as a student, there is somebody else already in that niche, and they're probably a community organization that doesn't have a lot of resources, but could definitely use the support and assistance of a soon-to-be or a recent graduate who can bring some expertise, bring some extra hands, and at the same time be building their resume. I mentioned at the top, the Public Health Commission has vacancies. As a large organization, there's always some turnover. I'm later today, I'm interviewing candidates for one of our inspector positions that's vacant. So keeping an eye out for those opportunities, and just even on the small level, I want to encourage folks that, you know, it's been a problem for a long time, and it's not going anywhere, is just the ecosystem of bad information out there, disinformation as far as, you know, um, pick your topic, but, to pick the trite ones, moon landing hoaxes and the world is flat. But, in public health, we have those too. And, as a student, as an MPH candidate or somebody who's recently graduated, you're a voice for sharing fact-based information and being able to boost the messages of trusted organizations. Like, I don't follow that many folks on social media, but I do follow the Public Health Commission and I share their stuff. So, um, again, I could ramble on about that, but, those are some concrete things that students can do.
And really helpful things. I think that getting involved is a critical beginning point and a watchword along your practice, whether you're just beginning or you're in the middle or moving on and forward in all kinds of other ways in the same work or new work. So, Paul, it has been a pleasure speaking to you and learning about your work, and I appreciate all you do for the city of Boston and all of its residents. Thank you for joining us and having this conversation.
Absolutely. Thank you so much for having me. This has been great to share, and I look forward to talking again if need be, and you have my contacts.
Wonderful. Thank you so much.
Thank you.